why compromise is sometimes a really good or a really bad thing. When talking to patients about the options for treatment, the orthodontist tendency, having spent all that time at university with all those certificates, is to try and correct everything. Particularly when talking to adults, that's just not going to work. It's either going to take too long, it's too complicated, or it's not what they came in for. So that's very much something that we're trying to move away from. But when we're getting down to the point of actually agreeing what to correct and what not to correct, so where that compromise lies, there's a couple of things that are incredibly important. When accepting an aspect of a patient's bite or whatever it might be, in certain situations, by not correcting that, we may compromise the thing that they do want to correct, i.e. we will create problems, or by not correcting it, we will allow certain aspects of their dental or oral health to deteriorate or get worse potentially. And in those situations where what the patient does want fixing isn't going to be fixed, or indeed where harm may come as a consequence of accepting some compromise, then for me that would be a bad compromise. On the other hand, and in lots of situations, by not correcting something, say straightening the top teeth but not straightening the bottom teeth, no harm will come and that situation will remain stable, then that can represent a really, really good compromise. The important thing about that is that we have to be focused not on being the orthodontist or the clinician in the white coat preaching from the pulpit, but actually about individualized care, about delivering a treatment plan and looking after patients in a way that they want to be looked after. So I see my job here as guiding them between the rails, keeping them on the tracks between the danger of a bad compromise and also the folly of going down a comprehensive orthodontic plan where that's simply not required to give that patient what they want. Above and beyond though, the most important thing is that perfect for anybody doesn't exist. Perfect as a single concept doesn't exist. What we're trying to achieve is just right for you. Putting you, the patient, the individual, at the heart of any decision making, rather than me, the orthodontist, with braces and pliers and all of that kind of stuff. Because at the end of the day, it's about looking after people. It's not necessarily about straightening all the teeth. Thanks for listening.